Hi, my name is Dr. Will Mosbey. Thank you for taking the time to watch this short video. I'm not a professional speaker. I'm a board-certified chiropractor with over 250 postgraduate hours in chiropractic and neurology. Now, what is chiropractic and neurology? Well, just as there are medical doctors that specialize in neurology or radiology or rheumatology, there are doctors of chiropractic that do the same. And out of over 60,000 practicing chiropractors in the U.S., there's about 1,000 chiropractic neurologists. So this video is about what makes my office different and how we go about successfully treating these difficult chronic conditions such as fibromyalgia, dizziness, migraine headaches, chronic neck and chronic back pain, sciatica, ADD, ADHD, and several others. Basically, we have a three-phased approach toward treating a patient in my office. We're going to look at you structurally, metabolically, and neurologically. And here's the key: treat the person, not their diagnosis. I don't care about what your diagnosis is or what label has been given to you by another doctor. As far as I'm concerned, labels are for cans and not for people. Many times I hear patients say they've already been to 6, 7, or 10 other doctors or even specialists, and the problem is they're too narrowly focused in what they look at, and they look at you through a microscope. We take a look at the whole person and not just the symptoms. No stone is left unturned to determine the exact cause of your condition. So most offices look at someone from like a pain perspective or a joint perspective. We look at the body as a whole. We have a multi-step procedure in evaluating someone's health. First off, we want to know what your problems are, all of them. Next, we want to do an initial screening to determine your problems. 3 is if the screening tests show that you are a candidate for our brain-based therapy program, we will then perform a very comprehensive neurological evaluation. And number 4, you'll get a full doctor's report that is given to you with an explanation of what is wrong, why you likely have the complaints you have, and a treatment program specifically designed for your problem. So, what makes us different? So here's the big secret. We're going to treat the brain and the nervous system, because it's your brain and nervous system that controls everything you do and feel and determines how well you function. And making you function to the best of your ability is my main goal and your best chance at being healthy and pain-free. So number 1, we're going to perform oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need 2 things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we will help you heal faster. And as we age, our ability to use oxygen effectively decreases. This process is called oxidative phosphorylation. It's a big term, not there to try and impress you. But we have patients exercise using an upper body ergometer. It's kind of like a bicycle for your arms. And they do that while on oxygen. So we can increase firing of the brain. And by increasing firing of the brain, we help patients heal faster. Number 2, we're going to use brain-based therapies. We use specific brain-based therapies such as vibration therapy. Vibration fires the back part of the brain called the cerebellum, and the cerebellum is responsible for 3 things: balance and coordination, controlling our spinal posture muscles, and lastly, it terminates our eye movements, allowing us to lock onto a target. The cerebellum is also the most oxygen-dependent area in the body. We may also use auditory stimulation by having you listen to sound in one ear, or visual stimulation by having you look at different pictures, or you might perform eye exercises. We're going to have you do olfactory stimulation where we have the patient smell different scents like peppermint or cinnamon. So for example, if we want to stimulate the left brain, I'll have the patient smell through their left nostril. We may use a warm caloric, which is water heated to 105 degrees and poured into the ear. This stimulates the same side cerebellum, increasing its frequency of firing. This is a very powerful modality for dizziness and vertigo patients. All of these therapies mentioned are used to increase the firing of different parts of the brain. As I mentioned, we may use eye exercises. This is used with a HemiStim, which is a computerized eye exercise program to stimulate specific areas of the brain done on your computer. Number 3, we're going to perform adjustments. We may utilize manual techniques or techniques that require the use of an adjusting tool. Adjustments may be unilateral, which is one-sided, to maximize the benefit. Number 4, perform postural rehab exercises. Postural rehab exercises are designed to improve or restore spinal structure and supportive tissue and muscles around these structures. One particular rehab exercise is cervical traction. Cervical traction improves the cervical curve and also activates the cerebellum, which helps to improve balance and spinal posture muscles. Another exercise is wobble board training, a fantastic exercise. This exercise is designed to improve overall balance and coordination along with activating the cerebellum and core stabilizers. Looks very simple, very tough though. Number 5 is metabolic treatments based on specific lab panels. Yes, we're going to be taking some blood. And by using these specific blood tests, such as number 1, a thyroid panel, number 2, a complete metabolic panel or a CMP, number 3, a lipid panel, number 4, a full CBC count, which is your complete blood chemistry. We can also assess the thyroid, the adrenal glands, the blood, and gut function. All can be affected with chronic health conditions, and by addressing any problems with your thyroid, your adrenal glands, your blood chemistry, or your gut function, we can help you to heal faster. So the complete metabolic panel allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. We'll also do an adrenal stress index, which is an ASI. We can further do this test with the adrenal glands with a test called the ASI. And your adrenal glands are your stress organs, meaning that they react to stress. So if you have been or are currently under stress, this test is a must. And if you suffer from insomnia, this test will measure your cortisol levels. And when your body's cortisol levels are abnormal, you will suffer from insomnia. Cortisol levels can be corrected via specific nutritional protocols, thereby curing your insomnia. We may test to see if you have an autoimmune disease. An autoimmune disease is where your immune system is on attack and attacks a particular area of the body. So we can test for specific antibodies to determine if you suffer from an autoimmune condition. Some of these antibodies are gluten, like gluten antibodies. Tissue antibodies such as myelin, which is the fatty sheath around the nerves. We can check for cerebellar antibodies, and the cerebellum, again, is the back part of the brain controlling balance and coordinated movement. We can also take a look to see if you have a bacteria called H. pylori. This is to determine if you have problems related to gut function. And lastly, number 6, we can perform a neurotransmitter assessment. We can test for decreased brain neurotransmitters. And neurotransmitters are vital for proper brain function. Decreased neurotransmitters can cause increased pain. So does that sound like that we're taking a look at the whole person? Well, you bet it does. So once we have ran the necessary tests to determine your specific condition, we can successfully treat you via proper neurological and all-natural nutritional protocols. So ask yourself the following questions. Number 1, how has your health been affected, or how has your health affected your relationships, finances, and family or other activities? Number 2, what does it cost you in time, money, happiness, or even sleep? Number 3, where do you picture yourself in the next 1 to 5 years if this problem is not taken care of soon? And number 4, what is it worth to you if we could improve your condition? Finally, don't hold this information hostage. Give this DVD or give this information to a family member or a friend that may be suffering. You have found the right place, and I look forward to seeing you and helping you be a better you.